Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
All right, welcome to another edition of American Potential. And, healthcare. We talk a lot about healthcare. We talk a lot about education. We talk about healthcare. I think about the barriers that are out there for people that government imposes. And man, I'll tell you, education and healthcare seem to be two that government has imposed so many barriers upon us in these areas. Healthcare, it can have as many barriers from which medical professionals are covered in which ones are covered in your in-network plan, as well as where you can go get care. But what if there was a different solution where you could pick the medical professional, the doctor, if you will, that you want and get personalized care? There is something out there that's just that, in fact, and it's called direct primary care. Now, it may not be for everybody, but again, as I say often on this show, this isn't always about you. It's about what's best for everyone and choices, and that's what this truly is about. Direct primary care. It's where a medical professional charges a monthly or a per visit fee, and you get to choose your medical professional. It's not a substitute for your insurance. And 30 states have already passed safe harbor laws stating that direct primary care is not a form of insurance, but the Internal Revenue Service, the good old Internal Revenue Service, they see it differently. So on today's podcast, we're going to talk about the benefits of direct primary care. And my guest is Americans for Prosperity Senior Policy Fellow, Dean Clancy. And this could be a great option for you and for your community and for your state. Dean, thanks for joining us. How are you today?
Oh, I'm great. Thank you. Wonderful to be here.
All right. Now, Dean, I'm in Colorado. You're in Florida, but you grew up in Colorado, right?
Yep.
So
I'm a Colorado boy.
Your dad was stationed in, were you born in Hawaii?
I was. Honolulu.
Were you a surfer when you were born? Did you come on surfing? Not quite.
Well, almost. I mean, it's analogous. Yeah.
So you moved to Colorado when you were a young boy, and then you stayed there until you left college, right?
Yeah.
And
then I went to D.C. Right.
Yeah, and tell us about your background. I mean, I think it's important for people to understand who you are, and I mean, you've been working in this healthcare policy arena at a very high level for a lot of different entities. So I'd love to have you give some of your background.
Oh, well, sure. Yeah, thank you. I got into health policy as a young man working in Washington. My first job on Capitol Hill was for a senior member of Congress, and this was at the time of the debate over Clinton care, which is really the sort of the Obama care of the 90s. It didn't become law, but it was similar in its goals and structure. And I was on the side of the debate that said, this is not a good idea, putting the government in charge of healthcare like this. It's much better to let market forces work and so on. And I got the job in the office, and people said, do you want to do health policy? Because nobody else in the office wants to do this issue. And I said, sure. And I've been doing it ever since. I've worked on Capitol Hill, both the House side and the Senate side. I've worked in 3 administrations in the White House and in cabinet agencies. And I've worked in the healthcare industry as a consultant and a government relations professional. And now, happily, all of that culminates in my twilight years. I'm a grassroots advocate. I'm trying to help make the world better. And all of it has been focused on health policy.
I fail to find a lot of areas where government gets heavily involved in the marketplace and makes a positive impact. I really can't find it. I mean, I know they skew the market, and they do that in healthcare. They do it in energy and so many other areas. I mean, this idea of trying to get government sort of off our backs in some of this and allow us to make choices. And these are choices that some people don't even get the chance to make because government never allows them to. And before we get into direct primary care, and I want you to explain what that is in a second, but what about that? I mean, do you have any philosophical thoughts about how government like stops people from just making everyday decisions about their own health care, and people think it might be some insurance company somewhere, or it might be their doctor or whatever, but at the root of it, in a lot of cases, it's government imposing that upon them.
That is absolutely right. I don't know if you've seen this. As a famous chart. It gets updated from time to time. You see it on Twitter and Facebook, and basically it's the price growth history of various elements of the American economy. And some of the prices you see are going up very heavily over time, and some of them are dropping dramatically over time. So, for example, healthcare, education, energy prices tend to be going up. Smartphones, computers, laser eye surgery, prices are plummeting. What's the difference between those two types of things? Well, government involvement. Mm-hmm. The government heavily gets involved in healthcare, education, and so on. And they've driven the price up and the quality down. And, so in general, government involvement is not helpful, especially when the private sector is capable of doing it. I think we all agree that government is needed to do certain things that otherwise we collectively just can't do. But the list of those things is really pretty small. And we let government just sort of sprawl and say, I think I'll get into healthcare, I'll get into education, I'll get into, free daycare for everybody and so on. And it's like, you know what? You're not adding a lot of value. And that is a problem.
Yeah. And, just a quick side note here, I bought a television the other day and was out shopping for them. And I was thinking, man, televisions, look how much better televisions are today than they were 20 years ago. I mean, technology wise, how much smaller they are, lighter weight, better picture, better sound, you name it, and cheaper, right? And I stopped to think, man, if government was regulating televisions, we'd have $3,000 bricks that, have 64, bits or whatever in them. I mean, they'd be terrible
like
quality.
Pong, yeah.
Yeah.
Right,
yeah.
Exactly. 1972 quality. Yeah, at enormous prices. That's exactly right. It's precisely because the government hasn't tried to dominate. The TVs just get better and better. My kids were making fun of me over the holidays because my wife and I bought a new, larger flat screen TV. And of course, it was affordable and it was great. But, they think we're some kind of, we're being indulgent or something. But it's just because the market made it possible.
Sure. Now, and let's explain, I think it's important for people to understand what is direct primary care.
Direct primary care is a new model of access to healthcare. It's new in that it's probably only been around really in the last decade or so, and it's growing like gangbusters. And how it works is you just pay your preferred doctors, or it could be like a facility, maybe an imaging facility, a set price every month, like a Netflix subscription. Mm-hmm. Or you could do it on a per visit basis. That's also direct. What makes it direct is you're not relying on insurance to be involved in the thing.
Right.
You're just paying out of pocket. And it's exciting because when you do that, you get back closer to the original model of healthcare, which was doctor and patient with no bureaucrat intermeddling, either a government bureaucrat or a health insurance corporate bureaucrat. It's just you and the caregiver, and it's built on trust. And so direct primary care is just direct payment for health care out of your own funds. So
this obviously, when you're bypassing an insurance company, a health insurance company, now they're not going to like that, right? Because I would imagine health insurance companies would love to see every American be required to have health insurance, right? Now, from a freedom standpoint,
they did in Obamacare, yeah.
Right, exactly.
That's basically been repealed, but yeah, that was their deal. They wanted to force everybody to buy their product. Absolutely.
Yes. Yeah, correct. So, but when you get them out of the equation, and it's a direct contract or a direct transaction between you and your doctor, I mean, that you must have examples of how that saves tremendous amounts of money for patients.
Oh, it's amazing. Yeah. First of all, it's more affordable because you're cutting out all that paperwork and bureaucracy. It can be very affordable. For example, here in the part of Florida where I live, there's a direct primary care practice known as Epiphany Health, and they charge $65 a month for an adult to have unlimited access to their doctors, and $10 a month for each child. So that's pretty darn affordable for most people.
Sure.
And what do you get? What do you get for that? Well, first of all, not just doctor's visits, but you can email or text or use telehealth with your doctor anytime, day or night, and they're responsive. One way to ask people about the quality of their healthcare is just say, well, do you know your doctor's personal cell phone number? Most people are going to blink at you. What?
Right.
Why? No, my goodness, I shouldn't have his personal cell phone number. Of course you should. Your doctor is an advisor, a counselor, somebody who's helping you, and you're paying for that. And in direct primary care, they automatically give that to you. And I asked the doctor who runs that particular practice, don't you have the problem of people overusing that amazing amount of access to you? And he said, no, actually, in general, they don't. Most people are just happy to have the access when they need it. And for those who are a bit more hypochondriac and, are constantly trying to interact with me, guess what? I've got the time to do it because the other people are not. So that's how direct primary care works in practice. And people love it. The doctors and the patients love it. The doctors get to practice healthcare instead of filling out paperwork for insurance companies. The patients get more time and higher quality with the doctors, and the doctors actually know them. They actually, it's not a 7-minute appointment where the doctor's got to look at a computer screen the whole time and then get you out for the next patient to come in. They actually spend time with you. It's better healthcare.
Yeah. Now, I want to talk. There's barriers to direct primary care, and that's what this show is about. That's what Americans for Prosperity is about: is removing barriers, particularly government-imposed barriers. And there's barriers to direct primary care at the federal level and at the state level in some states. Other states allow it. And I want to get into the state side of it in a second, but let's talk about the federal government. So this isn't insurance, right? Because it's just a contract between you and your doctor. But tell me, right, what's the barriers at the federal level this just seems like common sense. I ought to be able to do this, but there's actually a government law that makes it difficult for people to do this.
Absolutely. And I'm going to answer your question in a second, but I just thought of one more thing for your previous question about how it saves people money.
Yeah.
Another thing is direct primary care doctors will often give you amazing discounts on generic drugs, like 95% discounts.
Huh. Wow.
How can they do that? Well, they buy directly from the drug makers, the manufacturers. They cut out all the retail pharmacy and PBM and so on, all these middlemen in the system that you normally run into with insurance. But they just buy direct, and they might charge a dispensing fee and a little bit of a markup, but it's still like 95% cheaper in many cases. Wow. So that's another way direct primary care saves you money. But to your question about the federal barriers to this new model, they're very serious. The IRS, the tax collectors in Washington, have decided that, in their opinion, direct primary care is really a form of insurance. And therefore, under the tax laws, they have to treat it a certain way. It's not something that you can deduct on your taxes. So the monthly fee that you would pay to direct primary care, you can't deduct that on your taxes because under that law, you don't deduct insurance premiums. You can only deduct medical expenses, sort of out-of-pocket kinds of things. And second, they say if you have a tax-free health savings account, or at work, you could have something called a flexible spending account. These are basically vehicles, models by which people can pay for health services with untaxed dollars. So their health dollar goes farther. And those are created by the federal government. A lot of people use them. But the IRS says no, you cannot use those untaxed dollars for direct primary care. And then the kicker is the HSA law, the Health Savings Account law that governs those, also says you may only have one kind of health insurance. This is a crazy federal rule that significantly restricts people's ability to have a health savings account. And so because the IRS views DPC, direct primary care, as insurance, they view it as a forbidden second health insurance policy for anyone who happens to want to use a health savings account. So it's sort of a triple whammy. And the net result is people are forced to choose whether they want to be able to save tax-free for healthcare or have direct access to doctors. And they can't deduct the direct access costs from their taxes. And all of that makes no sense. So at Americans for Prosperity, one of our top goals with our personal option health reform agenda is to change that, change the federal law, so you can have all of these tools available to you without the federal red tape.
Yeah, that's just dumb. I mean, I don't know any other way to say it, but I mean, that's just dumb. That's a barrier that government has erected and said, you as the citizens of the United States can't have two different kinds of health insurance if you want, or you can't use these dollars in a health savings account for health care with your doctor. I mean, these are just dumb rules that have been put into place by regulators and by Congress, I guess. Is that right?
Well, it's partly Congress and it's partly the IRS. Yeah, right. It's the folks in Washington, and we need to fix it.
I mean, this is a great example of the kind of barriers that we have to tear down. If we're going to live as free people who want to control our own destiny and who want to live our lives as we see fit. And again, you may be listening to this and say, man, I would never do this. Great. That's your choice. We should all have the choice. Dean is not saying to you right now that this is how healthcare should be. Everybody should have direct primary care. Dean is saying this should be an option that if you want, your government shouldn't prevent you from doing it. Am I right, Dean?
You are absolutely right.
Yeah. Okay, so let's talk about the states, because different states certainly have a lot of regulation when it comes to healthcare. There are many states, I guess, that allow direct primary care and some that don't. Maybe you could tell us some of the ones that do and don't. And, what can people kind of do about that if their state doesn't allow it?
Well, you're right. The business of, or the practice of medicine is regulated by states in our system. The Congress and the feds have encroached on that significantly over the years, but it's still basically up to the states. So they can decide what constitutes the business of insurance versus the practice of medicine. Direct primary care is the practice of medicine. And if you treat it as insurance, now you're going to impose all these government rules and red tape that you impose on insurance companies. And they are a heavily regulated industry. And of course, in a lot of ways, that's good, because insurance companies, they have a very complicated product and they can play games, and they need to be held to a standard in terms of, providing what they promise, keeping their, fulfilling their contracts and so on. So since direct primary care is not insurance, it's important for states to actually pass a safe harbor law that clarifies this is not insurance. It's not regulated by the Insurance Commission. It's medicine, so it's regulated the way we regulate the practice of medicine in our state. And as you mentioned, roughly a majority, maybe 30 states have passed these laws, safe harbor laws. We need to get them in all 50 states. The states that have not done so, I don't have a list in front of me, but a lot of them are sort of your more regulation-centric sort of states or insurance-influenced state legislatures. New Jersey comes to mind, and there are others. And not every Republican or conservative-leaning state has a safe harbor law either, although most of them do. We just need to get all 50 states to pass these laws. And we're not saying that direct patient access to care, and by the way, I do like to call it direct patient care, because ideally, it wouldn't just be for primary care. It would also be for specialists and
Sure.
facilities and things like that, surgical centers. There's no reason you couldn't do the model for more than just primary care. But we need to make sure that that this is regulated appropriately in every state. And by doing that, then it's an option. Then people can do it. I think it would be a great world in which most people did it. And it's not a substitute for insurance. You still need protection against large financial, risks. But primary care and most ordinarily delivered medical care, certainly things that you can schedule in advance or shop around for. I'm not talking about emergencies. That kind of care doesn't ordinarily need to be paid for through insurance. It should be paid for through, with cash, basically.
Sure. So,
and go ahead.
No, well, I was just going to ask you. I mean, that's essentially what you're talking about. Maybe people don't understand. Like they don't necessarily. Maybe they're looking at this and say, "Well, this does work for me because it would be a substitute for insurance," and that's not really what you're saying here. I mean, somebody still needs what they used to refer to as a catastrophic policy, right, or something that covers hospitalizations and major illnesses and things like that. But that insurance wouldn't cover these smaller things, doctor's visits and things like that. You just directly contract those with your doctor. That's really what you're talking about here.
Absolutely. Yeah. Primary care, the analogy would be getting oil changes on your car.
Yeah, right.
Whereas you want the insurance for a car wreck or, a major fender bender. And as long as people have those things, they're going to feel that peace of mind of knowing they're protected, but they still have a lot of choice and control. That's what we're going after.
Dean, you're pretty awesome on the analogies. I got to say, in one episode, you gave us the grocery store analogy on healthcare. That's great. And I love that analogy on car care. Like, yeah, I mean, we have insurance, auto insurance, but it doesn't cover oil changes. It doesn't cover your alternator going out. It covers catastrophic accidents and the things that you really need insurance for. And that's kind of what you're talking about here.
Exactly. Yeah, it doesn't have to be overly complicated.
Yeah.
And the analogies, I think, help people understand. And if I could add just one other thing about DPC sure. While I'm thinking about it, direct primary care, price transparency. Sure. It's just automatic. They will tell you what things are going to cost in advance. They're going to help advise you, and they're going to give you referrals. So maybe you can obtain that MRI that you need or that lab test that you need at a discount. In fact, sometimes they build relationships with the local lab outfits and the MRI facilities and so on, so that you do get a discount. And they get the referral, mm-hmm. And it's just better health care. And they've got a famous surgery center in Canada that it's a hernia repair hospital, goes back to the 1940s. It's basically direct patient care. It's exempted from Canada's socialized medicine laws. They can take cash-paying customers. And guess what? They have some of the world's best quality care for hernia repair, lowest complication rates. People come in from all over the world to go there. Even Rand Paul, the libertarian United States senator, who's no fan of Canadian socialized medicine, got his hernia repaired at the Shouldice Clinic in Toronto, Canada, because that's a little island of freedom in their socialized medicine system. It's direct patient care, and it works.
Yeah, well, that's very interesting. So we don't have a ton of time here left, but I always want to ask for personal stories. I mean, have you heard from people who've used direct primary care? I mean, you just used, Senator Rand Paul, but have you heard about others using direct primary care, or maybe from providers themselves?
I have talked a lot to providers, more so than patients, but I've talked to both. What providers tell me is usually it's a story like this. I was a regular physician with insurance, or I worked in a hospital. I was overworked. I burned out. At night I would come home if they were a private practice physician, and they would spend all evening filling out paperwork for the insurance companies, basically. Mm-hmm. My life was miserable. I decided to quit and set up a direct primary care practice. Now I make less money, but I'm so much happier because I'm just delivering care to my patients. And of course, because the model works, my business is growing and, I'm not suffering financially, but I'm a much happier human being. It's a better quality of life. And by the way, it's not just physicians. I've met chiropractors who do this model. I've met advanced practice registered nurses who set up DPC clinics. Now, they might employ a physician to help them in their practice, but there's a lot of different models. And basically what you're having is a lot of these providers quiet quitting or loudly quitting traditional sort of insurance-centric healthcare and doing this direct care model, and they love it. And by the way, another barrier we need to remove is a lot of times these hospital systems will impose what's called a non-compete agreement on the hospital physicians, so that even if they leave, walk across the street, and just set up a direct primary care practice, which does not compete with the hospital. They don't compete with each other, but they can't do it because the hospital is trying to keep them from going to some other hospital. We need to change the laws so that those doctors have the freedom to do that. So those are some stories there.
Gotcha. Okay. And then just last thing I had for you is if somebody wants to learn more, right, about direct patient care, direct primary care, how would they learn more about it? And is there a website that they can go to, or how can they learn more?
Yes, absolutely. I would go to the website dpcare.org. Okay. And there's also a website called dpcaction.org. These are basically associations of these doctors, networks of these doctors who work together to improve public policy. And of course, if you're interested in actually using direct primary care in your area, you just look it up online and you will find they will advertise using a term like direct primary care or direct care. And then you can, chat with them and get to know more. And then, of course, I would hope people would visit personaloption.com, which is the site where we're trying to encourage people to communicate with their policymakers about this and other related issues, and also to educate them and policymakers.
All right. Well, Dean, what a great innovation, right, in the way we do business. Sort of getting this government interference, these crazy laws and rules that tell us how we can and cannot interact with our doctor. People always say, I got to get government out of the business. But this is a great example of government being in the business, and we need to get them out of it. Let people interact with their healthcare provider in that area. If you'd like to get connected to Americans for Prosperity and the state chapter, and you'd like to make a difference in your community, maybe you'd like to work on passage of direct patient care in your state, you can email me at jeff@americanpotential.com. That's jeff@americanpotential.com. And we'll get you connected. We'll get you plugged in to the greatest grassroots army on the side of freedom and liberty that the world has ever known, Americans for Prosperity. And if you'd like to stay up to date with this podcast, the American Potential Podcast, you can subscribe to our channel. You can like us on Facebook. You can follow us on Twitter, and you can follow us on Instagram. All right. Thanks to Dean Clancy. What a great episode of the podcast telling us all about direct patient care. Thanks for joining us on American Potential.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.